Optometry Students brought to you by OptoGlobe, the global optometry student community, proudly supported by Optometry Giving Site and VOSH International. Joining you from Nepal, my name is Nisha Bishowkarma, a recent optometry graduate from Institute of Medicine Tribhuvan University and the former secretary of Nepal Optometry Student Society. It is my great honor to moderate this session today. This is our Asia and Oceania session, and today we will be hearing from speakers and voices connecting India, the Philippines, Nigeria, and beyond, all under this year's summit theme, empowering the next generation through technological integration and infrastructure standards. Joining us today are optometry students, eye health professionals, and eye care leaders from across the globe. This diversity of perspectives and experience makes this community and this summit so special. Over the next 2 hours, we have a welcome address and opening remarks from a truly distinguished leader in global optometry, Dr. Rajeev Prasad, four student and professional presentations, a live Q&A, and a breakout discussion rooms, closing out with remarks from our Executive Director of VOSH International. Before we go further, a warm welcome and thank you to Padmize Gadimo, founder of OptoGlobe, whose vision brought this global community together. I'd also like to acknowledge Maria Arce Moreira, Executive Director of VOSH International, who is supporting us with technical assistance on Zoom throughout today's session and who will also be joining us later for closing remarks. And of course, our sincere thanks to the entire organizing committee, chaired by Dr. Laraiba Iftikhar, working behind the scenes today to keep everything running smoothly. Before we begin, a couple of quick notes to everyone here. This session is being recorded and will be later uploaded to OptoGlobe's YouTube channel. All the participants are requested to keep yourself muted throughout the session unless you're presenting or asking a question. If you have any questions during the presentation, please note them down. We'll be addressing them together during our live Q&A segment later in the session. And we will also be dropping a Google form later in the chat for attendance and certification. With that, let's get started. It is my pleasure to invite Kinza Zeb, OptoGlobe's Regional Director for Asia, to deliver our welcome remarks. Kinza Zeb is an optometry graduate from Ibadat International University, Islamabad, Pakistan, with a strong interest in comprehensive eye care, preventive vision care. I have got the information that Kinza is yet to join, so we will start by the opening speech from Dr. Rajeev Prasad. It is now my great pleasure to introduce our opening speaker, Dr. Rajeev Prasad. Dr. Prasad is an internationally recognized optometrist, educator, and leader in global eye health. He currently serves as president-elect of the World Council of Optometry, president of the Asia Pacific Council of Optometry, and Secretary General of the Indian Optometric Association. His clinical expertise covers myopia management, neuro-optometric rehabilitation, low vision rehabilitation, binocular vision, vision therapy, sports vision, and special needs vision care. He is also the founder and director of Visual Eyes India and has spent his career expanding access to eye care and rehabilitation services for underserved population worldwide. Please join me in welcoming Dr. Rajeev Prasad.
Thank you, Nisha, for a wonderful introduction. And I must say that thank you, OptoGlobe, for having me here. Good morning, good afternoon, and good evening. Fellow colleagues, optometrists, and the future leader of our profession. It's indeed my pleasure to welcome you all at this third optometry conference. And the gathering is more than an academic event. It is a celebration of collaboration, innovation, and our shared commitment to improving lives and improving vision and transforming lives. As technology advancing, global eye care challenges continue to grow, and optometry has a unique opportunity to lead with knowledge, compassion, and evidence-based practice. As the theme of this conference clearly says, empowering the future. So it goes hand in hand that today every student here, never, I would suggest never ever underestimate your ability to shape the future, because the future of vision care depends upon professionals who are willing to learn continuously, embrace innovation, and work across borders. I wish you all the inspiring conference filled with meaningful discussion and valuable learning and lifelong connections. So I'll just get started with my presentation. So as the theme rightly says, that the future's empowering the future. So, is my slide visible?
Yes.
Sorry, it is
Perfectly
visible.
fine. So the future starts now. Let us talk about it. What are the evidence-based innovations in vision health? So the mission and vision of the World Council of Optometry, that we envision a world where optometry makes high quality eye health and vision care accessible to the people. And this requires advocacy, continuous education, and the immediate integration of evidence-based innovation. And the clinical foundation is all based on understanding the realistic data, defining the current global burden of eye diseases, and escalating the gap in clinical care capacity. We all we all are aware of the global epidemiological burden, which is 2.2 billion people who are suffering with visual impairment. And the preventable crisis, WHO says that out of that 1 billion cases could be prevented or have yet to be addressed. Uncorrected refractive error beside cataract remains the leading cause, and pointing out to the systemic failure of primary optometric scaling and surgical access. The another part which is growing rapidly beside refractive error definitely is the escalating myopia epidemic. And the projection, as per WHO, says that 50% of global population, which is equal to 5 billion people, will be myopic, with 10% will be highly myopic. Now, what it leads to when we talk about myopia, myopia was a refractive error earlier also. Why are we so concerned about it? Because now it is very clear with the evidence and all the researchers there, this talks about that high myopia exponentially increases the risk of pathological macular degeneration, retinal detachment, cataract, and glaucoma. And standard single vision correction is no longer or adequate standard of care. And we all know that graph is increasing globally, and it is definitely a matter of concern. So what are the capacity bottleneck at this moment? The stagnant provider ratio. In many regions, the ratio of ECPs to patient is highly inadequate. Training to ophthalmologists taking over a decade. It will take a long, long time, and making linear workforce growth is impossible. In geographical disparity, clinical expertise is heavily concentrated in the urban centers. Rural and marginalized populations suffer disappropriately from late-stage diagnosis of irreversible blindness and diseases. And definitely the third is diagnostic, which is another bottleneck. Traditional slit lamp and dilated fundus exam require significant chair time, and the current model cannot physically accommodate the volume required to the universal preventing screening. So, and that's the opportunity. And WCO role in global advocacy and standard talks about the competency framework. We have IAPB, cooperation where WCO actively partner with International Agency of Prevention of Blindness on critical work group, including diabetic retinopathy, low vision, refractive error, and school eye health. And then it goes towards more of the clinical toolkit. What we have is deploying the digital resources, libraries focused on legislation, regulation, standard, and pediatrics to ensure the global optometric community, which has the policy of infrastructure needed to serve to the patients. I mean, I would recommend all present here that please refer WCO website about the competency framework program, and that has been developed, and that really talks about the standardization of the skill required through optometry to effectively participate. So what are the evidence-based innovation we are talking about? Moving ahead, definitely theories we all know, and we have to work about the clinical aspect beside the theory. And there are evidences where FDA has approved and peer-reviewed technologies actively redefining the standard of care. Coming right from diabetic retinopathy now, the IDEX and DR milestone talks about a lot of FDA approval which has come and which makes capable of diagnosing referable diabetic retinopathy without even human physical interpretation. This allows primary eye care clinics to capture high quality fundus image and receive an immediate diagnostic output, triggering only positive cases to ophthalmic specialists and vastly increasing the screening compliance. I mean, India is definitely a hub of diabetic retinopathy at this moment. So these things are really helping, and the clinical validation of diagnostic AI is very, very high. So in myopia arena, we talk about 3 M's, which is mitigation, measurement, and management. WCO advocates for educating parents and children on lifestyle modifications such as increasing outdoor time, which can delay the onset of myopia. Measurement, you have to actually measure, do a complete comprehensive examination, including the axial length, which is one of the baseline to track the myopia progression accurately. And the management, that transitioning from simple correcting of refractive error to proactively managing myopia progression using evidence-based and interventions, which is like ortho-K, and there are different lenses which are available along with low-dose atropine. Definitely in lot many countries and regions, atropine is not being prescribed by optometrists, but you can just definitely co-manage. Now, advancing the imaging, which is, OCT and angiography, it is a non-invasive imaging modality that generates high-resolution, depth-resolved 3D volumetric angiograms of retina and choroidal vascular networks without the need of fluorescent dye injections. As in many countries, optometrists are not allowed to use injections or, pharmaceutical drugs. So these innovations really help a lot in many ways. And it also helps in, by detecting the motion contrast of erythrocytes, clinician can objectively quantify the macular ischemia, neovascularization, and microvascular dropouts in glaucoma, which is far earlier than structural thinning that occurs. Coming to glaucoma, even the algorithm is really helping in terms of understanding how the progression is happening, and it can actually calculate the RNFL, which is retinal nerve fiber layer thinning over the time, and differentiating normal age-related loss from pathological glaucomatous progression. These regression and the algorithms allow to predict the time of significant visual field impairment, shifting treatment from paradigm to reactive lowering of IOP to proactive personalized target pressures. Dry eye, another area where optometrists can do wonders, which is all about diagnosing, tear osmolarity and MMP9, integrated the meibography and intense pulsed light therapy. And this is all FDA approved. Dry eye, if you refer WCO website that talks about Alcon's dry eye wheel, WCO Alcon's dry eye wheel, I will say to all the students and practitioners out here, make sure that you just refer the website of WCO for dry eye, and that this talks about that it is affecting 1.6 billion people. That is what has been the studies has updated TFOS News 3, and the evidence-based clinical tool streamlines decision making through the 3 core pillars. Again, it comes to mitigation, measurement, and management, and it incorporates the OSDI-6 questionnaire and directly linked to etiological drivers to tailored, peer-reviewed, and treatment protocols. Gene therapy. In 2017, the FDA has already approved Luxturna, making a watershed moment as an first of vivo gene therapy for genetic diseases, which can be delivered via subretinal injections and adeno-associated virus. Vector delivers a normal copy of RP65 gene directly to retinal cells. And this restores the visual cycle and significantly improve functional vision in patients with Bale RPF65 mutation and associated retinal dystrophies. Now, the evolution of optometric specialty, which is going way beyond now and it's growing, transitioning from basic refractive error to comprehensive medical management and specialized interventions. Definitely, the biggest challenge is legislation in many of the region. This has been a challenge, and again, I would go back to WCO, their competency framework, to refer to all those details. In many countries, optometrists are allowed to do even minor surgical procedures and using pharmacology, which really expands the scope of practice for optometrists. And advanced specialty contact lenses, clearer lenses at this moment, for all ocular surface disease and neurotrophic keratitis. This is a boon, and this is helping many more people from going blind. It's being rehabilitated very well. And the vaulting of, the cornea and maintaining the continuous oxygenated fluid reservoir over the ocular surface really helps in getting a good visual acuity, and that protect the eye when traditional therapies fails at this moment. The rise of neuro-optometric rehabilitation, my favorite subject, I would say, the TBI management, the stroke recovery, visual field loss, and the systemic neurological integration that is really helping in many ways. There are many countries where geriatric optometrists are needed. And, they can really play a major role in multiple sclerosis, Parkinson's, Alzheimer's by analyzing in that retinal biomarkers and ganglion cells complex thinning via OCT and all. The collaborative medical model has come in picture, and we are talking about always now co-management. So days are gone when we talk about, ophthalmology and optometries working separate, or we have that love and hate relation. But I would say, time has come where optometry and ophthalmology has to work together. And it is very much anticipated that, solid approach to eye care is rapidly being replaced by integrated of the co-management networks. And optometry are now serving as primary medical eye care providers, managing chronic pathologies, glaucoma, diabetes, and providing essential pre and post surgical care. And the integrated model drastically improves patient access, reduces surgical wait time, and optimizes the health system and ergonomics. Now, since the theme is empowering the next generation, so, one model which WCA has created, which is OPAL program, Optometry program of, in advocacy and leadership, it is a rigorous initiative designed to equip the next generation of eye health leaders and powerful strategies to enact change at policy and practice level, supported by OGS, Optometry Giving Sight. And this program trains the practitioners to lead the profession globally, promoting eye health and vision care as a fundamental human right with larger healthcare sectors. And redefining clinical education, as I said, empowering the next generation is data interpretation, advanced therapeutics, and intradisciplinary co-management. Teleoptometry, as I said in the initial of my talk, 2.2 billion have problem, and out of that 1 billion can be prevented. Teleoptometry can play a real significant role in that, in bridging the geographic divide. So teleoptometry is proven a safety, expand access to care, technicians capture high-resolution fundus photo and OCT scans, and on the retail setting for remote physicians to interpret. Home-based OCT monitoring devices are also emerging in clinical trials, allowing daily fluid monitoring in exudative AMD, patients triggering alerts for anti-VEGF injections, and only when it is clinically indicated. And this can be done remotely. So what is the structural roadmap? It starts with myopia management, universally adopted as standard care over single vision lenses in pediatric practice, widespread integration of automated AI screening and diabetic retinopathy in the primary eye care clinics, endocrine clinics, diabetologists, you can just work and co-manage. Routine of clinical use of OCT angiography for early stage glaucoma and diabetic macular ischemia management. And seamless, definitely tech-enabled optometry and ophthalmologist co-management ecosystem, which established significantly reducing the global burden of prevention of blindness. And this will definitely help in many ways, because we all know that there are economical burden of vision loss, productivity loss, like for an example, drivers, like uncorrected refractive errors is 65%, as mentioned in one of the Lancet Global Health. 20% is cataract, 10% is glaucoma and AMD, and diabetic retinopathy is 5%. And the vast majority of economic loss stems from conditions that are entirely correctable with established evidence-based optometric intervention. So what is the ROI, return on investment? It's 411 billion annual global productivity loss. The Lancet Global Health Commission estimates that we have 411 billion loss annually. Scaling primary optometric care can specifically dispensing spectacles and implementing preventive diagnostic AI is considered as one of the most cost-effective healthcare intervention available globally and yielding very high socio-income returns. So a clear tomorrow by embarrassing expanded medical scopes, collaborative care models, and evidence-based technologies, the next generation of eye care professionals will be able to eradicate the prevention of blindness. So start now. Thank you so much. Once again, I would love to, take a couple of questions.
Thank you, Dr. Rajeev Prasad, for such an insightful session. A wonderful way to set the tone for today's presentations. Uh, we will we will be address if participants, if you have any questions for him, you can drop it in the chat and
Yeah, I
your
can take it.
questions can be addressed.
Hello, good evening, Dr. Rajeev sir. Hope you are doing
Good
well.
evening, Manish. Yeah.
So thank you for the wonderful presentation, sir. So it was a very insightful presentation, and obviously from your presentation means we have learned means much more what optometry can do in the subspecialty and how they can grow. Sir, like I have one questions for me especially. Like as we know, like innovation in the diagnostic and AI continuously to involve. And how do you like envision the role of specialty optometry changing the next decade? And what are the competency should clinician develop to remain evidence-based future ready, sir?
Fantastic. I think wonderful question, Manish. And I personally feel that, the future belongs to optometry. And a couple of people here, I mean, they have visited my practice. I mean, my practice revolves around only and only specialty. So, we have come long way, right, from doing refraction to now getting into specialty, whether it is contact lenses, vision therapy, neurooptometry, pediatric, eye care, low vision rehabilitation. Not many people are aware that we have more than 20 specialties in optometry. So optometry can contribute in a big way. I mean, for an example, talk about India. We have, 145, almost 140 billion people. And we have close to 30,000 ophthalmologists. Now, the question is, will we be able to provide quality eye care? Ultimately, the end is like optometry has to come on the driver's seat. They have to work along with co-management. They have to come up with diagnostic clinics rather than just getting into optical shops. Once you get into diagnostics, you are able to diagnose, in first hand, like glaucoma, diabetic retinopathy, and so on, collaborate with ophthalmologists and take it forward. I think that's the future. It's co-management. I mean, I keep on seeing a lot of, I understand that there are a lot of, that hustle bustle between ophthalmology and optometry, but I think the time has come where optometry sits on driver's seat, take it forward, do co-management, and the future definitely of optometry is specialty. I hope this helps you, Manish.
Yes, sir. Thank you so much, sir.
Thank you, Manish.
Do you have any other questions for Dr. Rajeev Prasad? Anyone? So if you have any other questions, it can be again addressed in the Q&A session as well. So let's move on to our next speaker.
Great. So thank you, Nisha, and thank you, VOSH, for having me here. Thank you so much, Maria, Pemiji, and everybody.
Thank you, sir. Next, we welcome Wyndae Buenaobra, a graduating Doctor of Optometry student at Manila Central University in the Philippines with a strong interest in pediatric optometry and vision rehabilitation. She is the former chairman of the Junior Integrated Philippine Association of Optometrists at MCU and former Secretary General of Optometry Student Council. Today, she is here with us to share insight drawn from her academic journey, leadership experiences, and passion for community centered care. Ms. Buenaobra, the floor is yours. You have 15 minutes.
Good day, distinguished guests, respected professionals, fellow researchers, educators, organizational leaders, and students from around the world. It is a great honor and privilege to be with you today at the third Global Optometry Student Summit 2026. Thank you to the organizers for providing a platform where students, clinicians, educators, and researchers can come together to exchange knowledge, foster collaboration, and advance the future of optometry on a global scale. I would also like to extend my heartfelt appreciation to Manila Central University, Philippines, particularly the MCU College of Optometry for its unwavering support of student research and academic excellence. My sincere thanks go to our Dean, Dr. Catherine M. De Mesa, to our dedicated faculty members and administrative staff, and mostly especially to Dr. Jennifer Lynn J. Vignola, to our research advisors, Dr. John Lawrence V. Juarez, and Dr. Brian Joshua M. Bernardo, whose guidance, encouragement, and expertise have been invaluable throughout this journey. I would also like to express my sincere appreciation to my research partner, Mr. Rahul Celespada, for his collaboration, dedication, and commitment throughout the completion of this study. Today, I will be presenting our research entitled Vision Therapy Program Phases and Improvement of Functional Amblyopia among Patients in a Select Vision Therapy Center in Metro Manila, basis for a proposed management protocol. This study was conducted with the goal of exploring how the different phases of optometric vision therapy contribute to the improvement of patients with functional amblyopia. Throughout Through this research, we hope to contribute evidence that supports more structured, patient-centered, and clinically meaningful approaches to vision rehabilitation, while adding to the growing body of knowledge shared within our global optometric community. Before we proceed to the study itself, allow me to briefly introduce myself. I am Wyndae Richie de los Reyes Buenaobra, a graduating Doctor of Optometry student from Manila Central University, Philippines. Throughout my academic journey, I have been privileged to serve in various student leadership roles in our schools, such as the Optometry Student Council, Know the Glow MCU chapter, Student Volunteer Optometric Services to Humanity, MCU chapter, and the Junior Integrated Philippines MCU chapter. Experiences that have shaped my values of service, collaboration, and lifelong values of service. These opportunities have strengthened my commitment to contributing not only to the advancement of optometry, but also to the communities we serve. Over the years, I have developed a strong interest in pediatric optometry and vision rehabilitation. I firmly believe that restoring visual function goes beyond improving eyesight. It empowers children to learn, grow, and reach their full potential. It is this passion and commitment to evidence-based patient care that inspired the research I am honored to present today. Once again, I would like to acknowledge the individuals who made this research possible. This study was conducted in collaboration with my research partner, Mr. Rahul Celespara, our research advisors, Dr. John Lawrence V. Juarez, and Dr. Brian Joshua M. Bernardo. Now that I have introduced the individuals behind this research, let us begin by understanding the clinical problem that inspired this study. Vision is fundamental to a child's learning development and overall quality of life. When visual disorders develop early and remain untreated, They can affect not only visual acuity, but also a child's academic performance, social confidence, and future opportunities. One of the most common, yet frequently overlooked childhood visual disorders is functional amblyopia, which is commonly referred to as lazy eye. It occurs when the brain favors one eye over the other, causing the weaker eye to receive less stimulation and gradually lose visual function. Because this condition involves abnormal visual processing within the brain, simply prescribing spectacles is often not enough. Without timely intervention, it may result in permanent vision loss. Globally, amblyopia affects approximately 1 to 2% of the general population and 2 to 4% of children, making it one of the leading causes of preventable visual impairment among children and young adults. In the Philippines, the 2018 Philippine Eye Disease Study likewise highlights the growing burden of childhood vision problems, emphasizing the importance of early detection and appropriate intervention. Functional amblyopia is broadly classified into four major types: isoametropic, anisometropic, strabismic, and anisostrabismic amblyopia. Although all result in reduced visual function, each arises from a different underlying mechanism and responds differently to treatment. Understanding these differences is essential in selecting the most appropriate management approach for every patient. In our study, we focus on the optometric vision therapy, a structured and progressive rehabilitation program consisting of four phases: monocular, monocular fixation in binocular field or the MFBF, biocular, and binocular. Each phase builds upon the previous one, gradually restoring and improving binocular integration, reducing suppression, restoring visual function, depth perception, and stereopsis. This structured approach served as the foundation of our investigation and ultimately guided the development of the proposed management protocol. The rationale for this study was driven by two important factors: the limited local evidence on optometric vision therapy in the Philippines and our first-hand clinical experiences as senior clinicians. Through observing actual vision therapy sessions, we witnessed how structured and progressive intervention help improve patients' visual function and positively influence their daily lives. These experiences reinforce the need to examine the effectiveness of each phase of the vision therapy program. By generating Philippine-based evidence, this study aims to bridge the gap between international research and local clinic practice, ultimately contributing to more evidence-based, patient-centered management of functional amblyopia and better visual outcomes for children. Now let us briefly look at the structure of the optometric vision therapy program. The program follows a progressive, goal-oriented approach consisting of 9 therapy goals, divided into early and later phases. Each phase builds upon the previous one, gradually improving fixation, fusion, eye coordination, suppression, and binocular vision. To ensure that therapy remains effective and individualized, a binocular vision assessment is performed after every 4 sessions to monitor progress and determine the patient's readiness for the next phase. This structured framework formed the basis for evaluating patient improvement in our study. To objectively monitor patients' progress, a binocular vision assessment was performed throughout the therapy program. Beyond visual acuity, it evaluated key visual functions such as binocular vision, eye coordination, ocular motility, accommodation, suppression, stereopsis, and peripheral awareness. These assessments enabled clinicians to track functional improvement, monitor therapy response, and determine readiness for the next treatment phase. To evaluate the program's effectiveness, this study employed a retrospective, descriptive research design using existing clinical records, complemented by direct observation of optometric vision therapy sessions to provide clinical context. Patient records were screened using predefined inclusion and exclusion criteria. and a structured checklist was used to consistently assess improvement. The instrument underwent pilot testing for reliability, and the data were analyzed using descriptive and inferential statistics to evaluate patient outcomes and examine relationships among key clinical variables. So in this section, we examine the relationship between the type of functional amblyopia and the level of improvement achieved through optometric vision therapy program. The findings revealed a statistically significant association demonstrating that treatment outcomes vary according to the type of amblyopia. This suggests that patients respond differently to vision therapy based on their underlying visual condition. These results underscore the importance of accurate diagnosis and individualized, well-monitored treatment strategies to maximize therapeutic outcomes. Table 1 results emphasize that tailoring therapy to the specific type of amblyopia is essential for achieving the best outcomes, reinforcing the need for structured, individualized treatment pathways in optometric vision therapy. Next, in this section, we examine the relationship between patients' demographics and the level of improvement following optometric vision therapy. The findings revealed that both age and sex were significantly associated with therapy outcomes, indicating that patient characteristics may influence responsiveness to treatment. These results emphasize the importance of individualized treatment planning, allowing clinicians to set appropriate therapeutic goals and optimize visual outcomes based on patients' unique profile. Table 2 results confirm that age and sex are important factors in therapy outcomes, reinforcing the need for tailored, patient-centered approaches to optimize improvement and ensure achievable goals for each individual. Next, in this section, we examine the combined influence of patient demographics, amblyopia type, and the optometric vision therapy methods on treatment outcomes. The findings revealed a statistically significant combined effect, demonstrating that patient improvement is influenced by the interaction of multiple clinical and demographic factors rather than a single variable. These results highlight the importance of a comprehensive, patient-centered approach where treatment is individualized according to each patient's characteristics, diagnosis, and therapeutic needs to achieve optimal visual outcomes. Table 3 results confirm that effective management of functional amblyopia requires integrating multiple patient and treatment-related factors, reinforcing the need for a structured, individualized, and holistic approach to optimize therapy outcomes. Future research should continue to strengthen the evidence base of vision therapy through long-term follow-up, evaluation of treatment approaches, and collaboration among vision therapy professionals. Further studies across different population and clinical settings may help refine protocols, support personalized care, and contribute to the development of evidence-based guidelines for the effective management of functional amblyopia. We acknowledge that this study is only one step in advancing the field, and we hope it inspires continued collaboration and shared efforts toward improving patient outcomes in vision therapy. For parents, guardians, and educators, early awareness and regular comprehensive eye examinations are essential, as clear eyesight does not always mean healthy visual function. Timely evaluation, support for visual development, and proper referral can help children with functional vision challenges achieve better learnings and visual outcomes. The researchers recommend increasing community awareness on childhood vision disorders to promote early detection and intervention, encouraging outdoor activities, healthy visual habits, proper eye safety, and strong family support can improve therapy adherence and support children's overall visual development and well-being. This study reminds us that vision therapy is not only about improving eyesight, but about helping children see better, live better, and reach their full potential. Behind every record we studied is a child who deserves a clearer view of the world, a child with dreams, abilities, and opportunities waiting to be discovered. As future optometrists, we are reminded that our goal or our role goes beyond the numbers on a chart, beyond refraction, and beyond prescribing lenses. We are here to provide care that makes a meaningful difference, to help children overcome visual challenges, build confidence, and fully engage in their learning and everyday experiences. Because our work is not only about the refraction, but about a greater purpose to help children see clearly, to learn confidently, and to grow without any limitations. With this, I conclude my presentation for this study. Thank you for your time, support, and attention.
Thank you, Ms. Buenaobra, for sharing your research on vision therapy program phases and improvement of functional amblyopia. It is indeed our uh, it is indeed our responsibility to help the children see clearly for their better life and better future. Participants, if you have any questions for Ms. Bonabra, we can address that later in the question and answer session. Now, since our regional director, Kinza has joined us, please let us welcome her for her opening speech. Kinza is an optometry graduate from Ibadat International University, Islamabad, Pakistan, with a strong interest in comprehensive eye care, preventive vision care, and patient education. She is currently working as an optometry internee at Salecha Hospital in Dina Jalem, gaining hands-on clinical experience in vision assessment, primary eye care, and patient management. She previously served as OPTOGLOBE's Director of Students Communication for Asia and now serves as our Regional Director for Asia, helping drive international student engagement across the community. Please join me in welcoming our Regional Director, Kinza Zev. Ms. Zev, the floor is yours.
Good morning, good day, everyone. I hope you are all doing well. Where is my camera? Good day, everyone. I hope you are doing well. My name is Kinza from Pakistan, and it's truly a pleasure to be here with all of you. First of all, I had like to thank you, OPTOGLOBE, for inviting me to speak at the third OPTOGLOBE Global Optometry Student Summit 2026. It's an honor to share this platform with students and professionals from around the world. When I chose optometry, I thought it was mainly about helping people to see better. But during my clinical training and internship, I realized it's much more than that. Every patient has a different story. Sometimes they come with poor vision, sometimes with fear, and sometimes they simply need someone who will listen to them. As future eye care professionals, we don't just improve vision, we improve confidence, independence, and quality of life. One of the biggest lessons I have learned is that technical skills are important, but kindness and communication are just as important. Patients may not remember every clinical detail, but they remember how they were treated. Being part of OptoGlobe has also taught me that learning does not stop at university. Connecting with students from different countries has shown me that although our healthcare systems are different, our goal is the same, providing better eye care for our communities. To all the students joining us today, I'd like to leave with you with one message. Don't be afraid to ask questions. Don't compare your journey with someone else. Keep learning, keep practicing, and keep believing in yourself. The knowledge you gain today and the connections you build through communities like this can shape your future in ways you may not even imagine. Thank you once again to OptoGlobe and to everyone attending this summit. I wish you all a wonderful and inspiring event. Thank you. Thank you so much.
Thank you, Ms. Zev, for that welcome and for your work you and the regional team do to bring this community together. Now, moving on to the next presenter, we have Dr. Yogita Rajgandhi, a senior optometrist, academician, and low vision specialist with over 20 years of experience. She is the Vice President and Legislative Committee member of the DOA and President of the VOSH USA India chapter. She has published 57 articles and 121 reports, presented 32 research papers across 38 countries, and led over 414 eye screening projects, including a retinoblastoma project with the Indian Cancer Society. With an outstanding record in leadership, scientific publications, international presentations, and community eye care initiatives, she continues to inspire the next generation of eye care professionals through her commitment to innovation, mentorship, and lifelong learning. Dr. Rajgandhi, you have 15 minutes. Over to you.
Yeah, hello everybody. Namaste from India. Thank you, OptoGlobe, for giving me this once again an opportunity to present and address the student across the globe and my colleagues and seniors and leaders. I'm just waiting to start my screen, please. Just wait. Is it visible?
Not yet.
Not yet. Okay. Now, is it visible now?
Not yet.
Oh,
Oh, I think we have some technical issues right now. We will be right back.
Waiting.
So,
My friend is doing my presentation slides. I'll be speaking simultaneously. I'm so sorry for being patient. Um, Okay. Besides that, I would just like to address that I'm working past more than 25 years in optometry, and my specialized topic is low vision therapy for the special children needs, community eye health, and rehabilitations. Being a faculty in the many university and pursuing after my diploma, bachelor, master fellowship, I've been doing my PhD in gender and blindness, which was very close to my heart. And so today I've been given an opportunity. I will sum it up in a few minutes. I made my presentation very simple for the student to understand because during when I was pursuing my optometry, that time we didn't have the lucky enough to have those technology, and without technology also we could contribute to the optometry. So I think so you guys are very lucky to have the technology and the infrastructure and all the assistance across the globe. So this morning I just opened my two eyes and namaste from India. Siddharth, please go on the next slide, please. Yeah, next, please. Namaste once again. Thank you. They are my inspiration. They are the visually impaired female. And when I see them, I feel if they can able to live their life up to their vision and mission as an optometrist, even I can able to do the same thing. What are the basic human needs? I'm sure everybody knows about self-esteem, belonging, safety, physiological, and all the needs. But of course, along with that, now we added a Wi-Fi with AI also. Without Wi-Fi and without Chat GPT, probably the young generation, your generation, or the next generation probably may not able to survive. So delivery of our eye care model is like primary eye care, so the secondary eye care and tertiary eye care. The primary eye care goes to into the community eye center. The secondary eye care refers to the large hospitals, and the tertiary one where the National Eye Institute, whether the teaching or the hospitals, who have all the facilities about the surgeries and the rehabilitations across, and the institution academics as well. As per the WHO, the prevention of blindness also again goes for the primary, secondary, and tertiary. And we all have to, as an optometrist, to contribute to that. And along with that, the education is the very important paramount, and the training and rehabilitation of each individual. How does the Vision 2020 partnership, the WHO collaborates with the Ministry of Health in each respective region and country IAPB, and the task force are there, the regional working groups are there, the National Vision 2020 groups have been formed in each regions, and of course, individual like us, we as an optometrists, ophthalmologists, opticians, everybody works together. Organization, national programs, NGOs can contribute to the Vision 20 and the Vision 30, 2030 aim and vision and mission of WHO. I personally feel there are few factors which are affecting still to the eye care access. They are the accessibility to the eye care, the quality of eye care, the affordability of eye care, the time management or the time consuming. Awareness about eye health or the particular disease is very less. The trust between the patient and the optometrist or any eye care professional is a very essential part of it. Without the trust, probably we will not able to allow someone to even look at our eyes. And the professional ego between the few professionals, So I think so. These are the factors which we need to consider whenever we deliver in eye care across any part of the globe. What can be the future of that? We need a more vision centers rather than more eye care projects. The secondary centers, the tertiary centers are established in the 1 or 2 tier, 3 tier cities. Teleophthalmology and teleoptometry plays very important role. The migration of professionals from one country to other region or other regions and other cities probably also can affect that. And more professionals are there, but the volumes are less. The quality is less. So what we strive for excellence, equity of eye care, and empathy should be there from our side. Without empathy, quality of empathy, probably we will not able to deliver that. So India has, I'm very happy to share, past 5 years, the Indian government has formed the National Commission of Allied Healthcare Profession Act, and it includes the 57 professions which were not recognized earlier. So now we have a optometry council like physiotherapy, occupational therapy, psychology, nutrition, and all. And along with that, the government says it is the regulations, licensing, the maintenance, and the standard. So we have the one nomenclature across the country. We have the universal now syllabus across the country. And we have the 5 years program of Bachelor in Optometry now as per the international standards. So this is the last 5 years. The Indian government have done a lot of justice to the optometry. And this council will do the assessment of institution accreditations, the maintenance and the creation of the system which can improve further to the access and the research which probably the optometry can contribute to that, and the development, adoption of the latest scientific research and advancement in technology. So probably with this win-win situation is coming from the legalization aspect. I think so optometrists can do much better. We need a human resource, and of course it is a teamwork. Nothing can be achieved without any teamwork. So optometrists, the students, the freshers, third year, fourth year students, any project which you want to think about, execute, you need a project manager, the NGO, the voluntary organizations. There are grassroots workers, social activists, and there are different kind of a professional who can work together for the primary and the secondary eye care projects when you want to do it. I personally have executed more than 414 different eye care projects, and there are some of them which I would like to say when I show you some of my pictures. It has to be a cost-effective budget. Manpower should be good. Administrating, coordination, the leadership quality, sensitizing the eye health activity in the various states are very important part. And the lack of trained optometrists in public health is a need of an hour. Probably you can have the advisory group. You can collect and review the data from the previous, any project has been done by NGO or the government. You can create a plan for next 3 to 5 years. You can do the MOU between the two organizations, and probably you can have the strategy and policy, and then you can move ahead. Nothing is impossible in a life. That's what I feel it. If you want to do it, you can have the different the way of approaching. And if you have vision and mission, I think so technology and infrastructure will definitely take a secondary part, but it should come from your heart to do something which you want to contribute to the optometry, your society, community, and your region. So basically, the training part comes from your academic institution, the supervision comes from your expert faculty, the communications. It is very good. Even if you pass out from your college, do not forget your teachers, express the gratitude to them, and probably you can further pursue your educations. And you can do a lot of research and publication, as the previous speaker was speaking about. I personally feel the role of optometrist comes as eye care for primary eye care responsibility. The prevention, the health education, health promotion, health maintenance, the diagnostic part, treatment, rehabilitation, consultation, and counseling plays very important role. Like the previous speaker was speaking about the same thing. When I enrolled into the optometry, it was not choice of my profession, it was by my chance. So but I do not regret about it. And yes, if you want to do some difference to your family, your profession, to yourself, I'm sure the optometrists can do a lot of things. So even as a student and as a fresher, I was also looking like this, and I said, what next? And then I started approaching different NGOs, like Rotary Club and Giants International and many other local NGOs. And I conducted a lot of eye health education program for the uh, marginalized students, children's. They were the sports academy. They did not have access to educations, and the children at the primary level and the secondary level also, and guiding about them about eye and nutrition, eye and refractive error, and now there is a digital eye strain. So there are many topics you can cover under this particular age group. And this was one of the project which was very close to my heart, with the work with Indian Cancer Society for the eye cancer, which happens only in children from age starting from 1 month to the 4.5 year. It is a retinoblastoma project. In 126 days, I screened around 4,627 children across the Maharashtra, and it was a wonderful experience to, screen their eyes and find out many other refractive error and other anomalies of the eye, and education awareness to the Anganwadi workers, primary teachers, and the parents. It worked very well, and it was a very well executed project, and I was glad to be selected part of it. This is one of the tribal areas, and in Maharashtra, probably where I traveled more than 200 kilometers. In Gujarat state, the below picture and the second picture is also about the Uttarakhand state in a northern part of India, where entire hill station is there. Even to reach at the school, you have to travel for nearly 7 to 10 kilometers. So, it was a wonderful screening program in a multiple part of multiple cities of India, which I have executed. And it's been a pleasure to do that. And India nearby, we have Andaman Nicobar Islands, and there also 36 islands out of 537 islands have been habitated. And I was happy to be part of 7 islands to look for the eye screening program, rehabilitation program, and contributing to Andaman Nicobar Islands as well. So finally, I just want to say that the success mantra, mistakes can prove that you are still trying it. You are not given up. And continuous improvement also definitely say, I only say every day I can do it. So I'm sure you all can do it. Just want to acknowledge the Optometry, OPTOGLOBE community members, this team for working so much hard past few weeks and few months. The VOSH International USA for giving always support to such academic seminar across the world, and it's like a family organization for me. Thank you, Maria, for always being there and for supporting and understanding. The founder president, Dr. Pemiji Gadimo, always responding to my messages and enrolling me and giving an opportunity and this wonderful platform to execute this particular talk to all the students. My institute, Rajgandhi Eye Care Institute, many NGO and institutions, without their permission, I would have not included these photos. My parents, family, and Indian Army. So I just would like to pledge everyone to donate your eyes. It's a beautiful gift which you can give it to others. You can get connected with me, my email, my website, yogitarajgandhi.com. And thanks, take home messages that the size of the audience doesn't matter. You just have to keep doing your good work. If you have any questions, I'll be happy to answer. But never stop learning because life never stops teaching you. So happy learning and happy practicing. Thanks to my parents who always supported me. Stay safe, healthy, informed, connected, and stay blessed always. I'm sure with the advanced technology, you all are going to be blessed. Proud to be Indian woman and proud to be more optometrist. I'm sure I've done good job to the presentation. Thank you so much for being the great audience and thank you once again for giving me this opportunity. Thank you.
Thank you, Dr. Rajgandhi, for packing so much insight into such a short window. As she said, primary and secondary eye care projects are group efforts. As in students, we can also directly or indirectly contribute in different eye care projects. If participants, if you have any questions for Dr. Rajgandhi, we can note it down now and we can address it later in the question and answer session. So let's move on to our next speaker. The speaker in this segment is Mr. Siddharth Salecha, an entrepreneur, business strategist, and industry educator. He's the founder of Salecha Lifestyle LLP, an Indian eyewear company, and the visionary behind MOGA, making great again, a movement dedicated to empower optometrists and eye care professionals through business education and leadership development. His mission is to bridge the gap between clinical excellence and business excellence in eye care. Mr. Salesa, please go ahead. You have 15 minutes.
Namaste and a very good morning, good afternoon, and evening to everyone. It is truly a privilege to be here with all of you today. So, firstly, my sincere gratitude to the entire team at OptoGlobe and the organizers of the third Global Optometry Student Summit for giving me this wonderful opportunity to share my perspective. And also, thank you, Dr. Yogita Gandhi, to have me here. So, thank you for bringing together such an inspiring community of students, educators, clinicians, researchers and eye care leaders from across the globe. So, to all the students attending this summit, thank you for choosing to invest your time in learning, growing, and shaping the future of eye care. I am Siddharth Salecha, a business coach in the eye care industry and founder of Salecha Lifestyle. Over the last few years, I've had the privilege of working closely with the optometrists, optical retailers, and eye care professionals across India. Today, I'd like to share my perspective based on my experiences working with optometrists and sharing on how we can bridge the gap between the classroom and the clinic and why the bridge may be one of the most important investments we actually make in the future of
Hi,
optometry.
Mr. Siddharth. Sorry to interrupt. So can you make your slide in slideshow mode?
Yeah, sure. Is it clear
Thank
now?
you.
So thank you
Yeah,
once
now it
again
is
for
fine.
having me here. So let's begin. So my perspective today, my point of view would be the journey from classroom to clinic. Okay. So those who actually feel graduation is the finish line, it is not. It is just the day one. Because we talk about bringing technology to every corner of the globe, but technology without a prepared professional behind it doesn't close the excess gap. It just relocates it. Right. So today I want to talk about the other half of the infrastructure, we the people. So, what graduates face on day one? So, clinical training builds knowledge, but the real world demands more. We need clinical confidence, we need patient communication, we need good technology adoption, we need to practice our management, and we need entrepreneurship. So, building something beyond a job, okay, and applying textbook decisions under real pressure, it is what students usually face when they graduate from their colleges or institutes. Now, let me come to the missing infrastructure. What is actually missing uh, in the ecosystem? So universities teach knowledge exceptionally well, but knowledge alone does not produce a confident professional. Between the classroom and the clinic lies an invisible gap, one that leaves many graduates underprepared for the complexity of real world practice. Now, as you can see the graph, where I've clearly mentioned that the classroom, when you attend your classroom, you have knowledge, you have theory, you go through exams. Then there is the gap which is full of confidence, application, soft skills, hard skills, entrepreneurship, learning about and understanding about systems, processes, and SOPs. Now, this is where it helps you to enter the real world when you are starting your own practice or you are finding yourself a job. Then comes confident professional who is actually practice ready, impactful, market ready, and patient ready. Now is when you become ready after completing the gap in your career. Yes, technology can accelerate the journey. The right tools used wisely can actually close the gap faster. So we can have, and we already have AI assisted diagnostics. We have teleoptometry. We have virtual patient stimulations. We have digital case libraries and EHRs. We have online mentoring platforms as well. But the main thing is that we have to be well prepared to use this technology in the right time, in the right way, at the right place. Now that is what is important. So what are the five pillars of a practice ready professional? See, confidence is not accidental. It is built systematically, collaboratively, and over time. These things take time. So that's where these five pillars come in, where you have to keep on learning. It can be evidence based, clinically relevant, and continuously updated. Second is mentorship, where you can experience guidance through the most difficult transitions. Then comes clinical exposure, where real patients, real decisions, and real accountability kicks in. Then technology, tools that amplify capability and expands your reach, right? Then comes industry collaborations, the real partnerships that connect learning to opportunities, because that is what is important. If you don't turn your learnings into opportunities, then you are actually standing nowhere, students. So the future student journey looks like this. When education, technology, and infrastructure work together, every stage of development becomes intentional. University, where foundational knowledge and core skills are developed. Then simulation labs, where hands-on practice in safe settings are kept. Then AI-assisted learnings, where personalized technology-driven instructions can be given through AI after feeding your thought process to it. Then comes clinical internships, where real-world supervision excellence experience takes place. So my ask to everybody, or my say to every optometrist over here today in the meeting, is don't just stay as an optometrist. I am Siddharth Salecha. I am not an optometrist. But I would also like to share this to you, that don't just stay as an optometrist, become a builder for the industry, because it actually needs you. It needs good optometrists to shape the future of this industry. What can you do to not be as just as an optometrist, but become the builder or the leader of the industry? You can have your clinical practices, you can become an innovator, you can become a researcher, you can become an educator, where you educate more students coming in, more the future generation. You can become a policy maker, you can become a community builder, you can become a leader, you can become an entrepreneur. So you have a lot of masks to take on. Just don't think that you are an optometrist and that is enough. No, if you want to take this industry ahead somewhere, you need to be the builder and you need to look at the bigger vision. And this is our collective responsibility, where every graduating student deserves more than a degree. They deserve the confidence, they deserve the skills, the mentorship, the technology, and the opportunities needed to succeed in the real world. The gap has to be filled for every student to successfully choose their career. Let's bridge the gap between classroom to clinic. This is what I call it. So the future of eye care won't be transformed by technology alone. It will be transformed by professionals who are prepared to use it with competence, compassion, and confidence. So thank you so much to everyone present. And this is I'm very grateful to everybody to hear me out, to take your time and attend these sessions. If you have any questions, you can please let us know, and you can definitely feel free to reach out on my WhatsApp number or my email ID, or this is my Instagram page QR code, which can give you an access to the outside world learnings where I keep on posting things. So thank you so much. If you have any questions, you can please ask.
Hi, Siddharth
Thank
sir.
you, Mr.
Hello.
Hello.
Do we have any questions
Am I
for?
audible?
Yes.
Yes.
Sir, thank you for this insightful presentation, class 2 clinic. So, my question is like right now means if you'll see the traditional teaching method, and then right now we are means mainly focus on the active learning, we mainly involve in the active learning strategy.
Okay.
So, which like what method like we have to go through, and then which method will be one of the best in the active learning strategy set? So any
Okay.
take on this?
So if I can just backtrack it, the question of yours is that what should we actually learn? Do you mean something like that?
Yes, yes.
Okay. So see, Manish, you see there are many verticals where you can go through, right? So you can learn about business, you can learn about creating the right systems, SOPs, processes. You can learn about business functions. You can learn about different kinds of optometry practice. As Dr. Rajeev Prasad rightly said, that there are so many opportunities where you can do your specialization. So you can choose your specialization. You can start learning about those things which are actually different than what others are doing, right? Because that is what will keep you differentiated from other students or from other practitioners. So I think you should learn each and everything whichever comes across your path, because learning anything will not ever waste your time, because once in a lifetime moment you will have that time where you will implement those learnings into opportunities, and you can create good future for yourself and for the country. So I think learning, you should never choose between what should I learn, whether this or that. I think you should learn each and everything, even if it is not relevant for your career right now, because learning should never stop, is what I believe. Yeah. So I hope that answers your question, Manish.
Thank you,
Okay.
Mr. Salecha. Um, the rest of the questions will be addressed in the Q&A session. Thank you, Mr. Salecha, for highlighting on journey from classroom to clinic. I'm sure that your segment was helpful for the students and recent graduates who are here with us, how we can accelerate our journey, how technology can accelerate our journey as an optometrist and as a builders, and how we can turn our learnings into opportunities. Thank you so much for valuable insights, sir. Now, let's move on to our next speaker. Our final speaker, we have Peace Earnest, a final year Doctor of Optometry student at the University of Benin, Nigeria. She currently serves in public advocacy and strategic planning at the Optometry Scholar Academic Forum National, and previously served as the 2025 president of OSAF's University of Benin chapter. Her research interests include visual function, accommodative disorders, public health, optometry, and healthcare seeking behaviors. Let's welcome Miss Earnest for her presentation. Miss Earnest, over to you. You have 15 minutes.
All right, thank you so much. Thank you so much. Please, can you help share my screen? I'm trying to share it right now, but I cannot do that currently.
You should be able to share your screen.
Um, Okay, I'm working on it. I'm coming.
Can we get some assistance from the technical teams? He has shared us the presentation in the group chat as well.
Okay. Okay, please, just a moment.
Please go ahead, Ms. Earnest.
Okay, thank you so much. Thank you so much. So, good day, everyone. Distinguished professors, respected doctors of optometry, esteemed guests, fellow students, researchers, ladies and gentlemen. My name is Earnest, a final year optometry student from the Faculty of Optometry, University of Benin, Nigeria. It is an honor to present my proposed research titled Effects of Graded Oral Glucose Intake on Amplitude of Accommodation among Undergraduate Students at the University of Benin, Nigeria. Thank you for this opportunity. Accommodation is the eye's ability. Please, the next slide. Accommodation is the eye's ability to adjust its optical power to maintain a clear image of objects at different viewing distances, mediated by neural control of the ciliary muscle, and is essential for comfortable near vision. Although accommodation has been and refractors, less attention has been given to the possible influence of acute metabolic changes, particularly following oral glucose intake. Previous studies have mainly focused on individuals with diabetes or chronic hyperglycemia. However, limited evidence exists regarding the short-term effects of graded oral glucose intake on accommodative amplitude in healthy young adults. This gap in knowledge provided the rationale for this present study. Next slide, please. The aim of this study is to investigate the effects of graded oral glucose intake on amplitude of accommodation among undergraduate University of Benin. Employ a within subject pre-test, post-test design among undergraduate students of the University of Benin. Next slide, please. Eligible participants will attend a morning session after fasting overnight for at least 8 hours to establish a consistent baseline before glucose administration. Following informed consent, participants will undergo a brief ocular assessment, including near visual acuity testing and anterior segment evaluation to ensure they meet the study's eligibility criteria. Baseline amplitude of accommodation will then be measured monocularly using the minus lens to blur method at a testing distance of 40 centimeters because of its good repeatability and reduced tendency to overestimate the amplitude of accommodation. Participants receive graded oral glucose of 15 gram, 20 gram, or 25 gram, standardized according to body weight. Amplitude of accommodation will subsequently be measured at 30, 60, and 90 minutes following glucose ingestion to evaluate any temporal changes in accommodative function. Data will be analyzed using SPSS. Repeated measures, statistical analysis will be used to compare accommodative amplitude across different time points and glucose doses with statistical significance set at p less than 0.05. What would be the expected significance? Next slide, please. This study seeks to determine whether acute oral glucose intake produce measurable changes in accommodative amplitude and whether any observed changes vary across graded glucose. The findings may contribute to a better understanding of the relationship between systemic metabolic changes and accommodative function in healthy young adults. Now, the conclusion. This study addresses an area that has received relatively limited attention and seeks to provide additional evidence on the relationship between oral glucose intake, and accommodative function. I hope the findings will contribute meaningfully to the growing body of knowledge in vision science. Thank you very much for your attention. I welcome your questions, your comments, and your suggestions. Thank you so much.
Good evening. I have a question. Can I?
Yes, please
Yes.
proceed. Proceed.
Okay, I wanted to ask one thing, that on which basis you will decide that the inclusion criteria that students will take about 15 grams, 20 grams of glucose. I mean, everyone has a different metabolism. So how will you decide that group? On which basis you are prescribing 15 gram, 20 grams? Can you please explain it?
Okay, thank you so much for your question. So the 15 gram, 20 gram, and 25 gram is standardized according to the 70 kilogram weight. So if we are giving to individuals who are varying, we are giving them according to their body weight. That is why the inclusion criteria will include your body weight assessment. So according to your body weight, individuals will take the glucose that is standardized according to their own body weight. I don't know if that answered your question. Hello, sorry, did that answer your question?
Oh,
I think she's muted.
thank you,
I'm
Miss
sorry,
Earnest,
did
for
that
sharing your.
answer the question?
I wanted to ask that will you make a solution of glucose? How the patients will consume glucose?
Okay, the patients will consume the glucose with water, which is 60 ml of water. Everybody is going to take 60 ml of water. Do you understand? So they will take the glucose with that water and they should consume within 5 minutes. So each person is taking the glucose according to their own respective body weight, which is standardized to the 70 kilogram weight of a person. The 15 gram, 20 gram, and 25 gram is standardized according to 70 kilogram weight. So according to your weight, each participant will take either the 15, 20, or 25 gram, because we're going to have like three grade of glucose, so that we can compare each gram of glucose that is given to participants to know if the effect of amplitude of accommodation varies according to the increase in glucose consumption or not. So it's actually a proposed study. So after that, they would consume that glucose within 5 minutes with water. They can either mix the glucose with the solution and take it, or they can take the glucose and then consume the 60 ml of water. All right, did that answer your question? Are there more questions, please?
Yes, thank you, Miss Ernest, for sharing your research and addressing the questions. That bring us to the end of our presentations for today. Thank you, our presenters, for such a rich range of insights from clinical research to pediatric care to eye care entrepreneurship. We now open the floor for live Q&A. If you have a question, please raise your hand or drop it in the chat. And please also give us our short introduction before asking the questions. And and you can also mention which when and you can also mention for whom your questions are, for which speakers are you addressing to. Participants, the floor is open for the Q&A session. You can drop your questions in the chat, or you can raise your hand and unmute yourself to ask the questions to our presenters. Do we have any questions? So we have a question from Baisa Mohammed. Please pardon my pronunciation. I think this question is for Miss Peace Earnest. Uh, they have asked, how will the research on the effect of glucose to amplitude of accommodation have an impact in future eye care? Miss Peace Earnest, we have a
All
question
right.
for you.
Okay, please, can you take it again?
How
Can you
will
take
the
the question
research
again? Okay.
Yes. How will the research on the effect of glucose to amplitude of accommodation have an impact in future eye care?
Okay, current research that we have now focus on the effect of glucose on diabetes and chronic hyperglycemia. So little attention is being focused on the metabolic effects of glucose on amplitude of accommodation. And then we all consume a lot of food, and the end product is usually glucose, most of our carbohydrates. So we want to see the impact of this on our visual function. So this is like the future effect of this proposed research.
So have she addressed the question, your question, Miss Paisa Mohammed? Thank you, Miss Ernest. Now we can participants, if we have more questions to other presenters as well, we can proceed with that. This is the open stage for the question and answer. Participants, the floor is open for the question and answer session. Yes, we have another question in the chat. No, there is no any other questions, I think. So I think we don't have any more questions, so we can proceed to our next segment, breakout sessions. Now it's time for our breakout sessions. You'll be joining moderated discussion rooms facilitated by our speakers and moderators, where you can dive deeper into today's topics into smaller settings. In room A, we have total 5 breakout rooms, and in room A we have technology in optometry education, and in room B we have clinical infrastructure and access. In room C, we have student leadership and advocacy. Room D, we have innovation and research in eye care. And in room E, we have building regional partnerships and networks. Participants are requested to join your preferred room. We will rejoin here in 25 minutes for our closing remarks. Thank you.
Um, Students, can you please join the groups? And I need Eunice Cameron to accept the invitation to join a group because she is facilitating discussions. I need Andre Angelo also to join the group. I cannot find him in the groups. He's facilitating another group. And Hijab, Kashika, or Rida also, they need to join the groups to facilitate the discussion. So please accept the call to join groups. Thank you.
The Student Summit. It is now my pleasure to introduce Dr. Laraiba Iftikhar, Chairperson of the OPTOGLOBE 2026 Summit Organizing Committee, who will share our final closing remarks. She is a clinical optometrist and consultant with hands-on experience in comprehensive eye care and an experienced public speaker who has moderated numerous medical and academic events herself. Please join me in welcoming Dr. Laraiba Iftikhar.
Hello, everybody. Thank you so much, Nisha, first of all, for introducing me. And then, as we conclude today's Asia session of the Global Optometry Student Summit, I would like to extend my sincere gratitude to everyone who has joined us today. First and foremost, I would like to thank our esteemed speaker for sharing their expertise, their experiences, and their valuable insights. Their contributions have enriched today's discussion and inspired all of us to continue striving for excellence in the field of optometry. And to all our participants, thank you for your active engagement and your enthusiasm throughout the session. Your presence have reflect the strength of our global student optometry community and the shared commitment that we have for learning, collaboration, and improving the eye care worldwide. I would also like to thank the organizing committee because their dedication, their professionalism, and their hard work being the scenes behind all the work that is being done by them. It was truly appreciable, and they have made today's session possible. As we continue this journey together, your feedback is incredibly important to us. We are committed to making each session better for you than the last one, and your suggestion will help us achieve that. So, I will be sharing my email address or my contact number in the chat box shortly. So, please feel free to reach out to me with your feedback, with your questions, or your suggestions. And we would be more than happy to hear from you and to make the possible changes. Also, I would like to invite you guys for the upcoming session that we have on day 2, day 3, and day 4 of the summit. We have the exciting lineup of speakers and discussion ahead, and I have to welcome you all back as we continue learning, connecting, and growing together. On the behalf of the entire organizing committee, me being the chairperson, would like to thank you all for your time and for your participation. Lastly, I would like to say that the future of optometry is not something for the for something that we have to wait for, right? It is something that we create. We are creating right now, and we are working onto it. So, waiting for something to bring the change that, all right, the future of optometry is going to get better by some time or by some other person, we are supposed to put the change forward. We have to advocate the change. So, uh, lastly, I would like to tell you guys to have a wonderful day and thank you for being the part of the Global Optometry Student Summit. And we look forward to welcome you for the next session. Stay safe and see you soon. Thank you so much.
Thank you, Dr. Laraiba, for your closing remarks. Participants, we have dropped the Google form in the chat. You can fill it up for attendance and certification. And I'd also ask the participants if any one of you would volunteer to give us the feedback about the breakout rooms. What did you discuss in the rooms, and what are the insights you got from the different breakout rooms? Please, the floor is open.
Nisha, there is something that I want to add here that I felt like the students are right now hesitating to put on their points in the breakout room as I have experience facilitating the room. So I would suggest you guys that don't be shy because there is nothing like your answer is wrong or right. Right? We are here for a discussion. We are here for making a positive impact. So it does not matter if you say something wrong, right? There's nothing wrong. You can say whatever comes to your mind. That is your perspective, and we highly appreciate it. So I expect you guys to be more active tomorrow in the breakout room as we will come with a new topic, with new discussion points. All right.
Thank you very much, Laraiba, for that. I was also going to just admonish everyone on that as well. In my own room, we spent most of the time doing introductions, and before you knew it, 25 minutes was over. But we're able to have a conversation, although Vincent Zosa from the Democratic Republic of Congo was trying to make a contribution, but I think the internet connection was not very good, so I couldn't hear him. However, we were discussing about the regional networking, collaborations, institutionalizations for optometry students. We're able to, the big question was how many regions do have such arrangements? I know in Africa there's AFOS, right? I mean, for students, but some colleagues said that there are some online groups, social media groups, which I think are good. And fortunately, before we could share them in chats, I think the breakout rooms ended, and I saw that someone was asking for how, from Egypt, how they could connect with uh, the international groups or continental groups, and I will be putting my email in the chat. That's for Russia Hassan, so you could reach out to me. But basically, that was what was, or that was a conversation we were stemming up to discuss in my group or in my breakout room, and I hope tomorrow will be a much more interactive breakout session. Thank you. I do not know if maybe any other group has something.
Thank you, Padmize. Now, do any other rooms have their feedbacks or discussions to share?
I would like to share one for the technology in optometry education. We've in the breakout room, we've discussed how technology become part of the optometry education through online lectures. We also incorporate technology in how we practice, how we transition theoretical knowledge through practical patient handling, such as using modern diagnostic equipment such as digital retinal cameras, visual field analyzers, and such. We've also discussed how such technological and advancement supports a more precise diagnosis and personalized treatment for each patient which we encounter. And which leads to a better patient outcome while improving the efficiency of optometric practice. In short, we have agreed on the idea that though we have such advanced um, technological devices, we would like to incorporate it with traditional means to have a better uh, clinical judgment on providing the best possible outcome and management for the uh, patient.
Thank you. Now let's move on to the vote of thanks. It is now my pleasure to invite Maria Arce Moreira, the Executive Director of VOSH International, for a vote of thanks. With 20 years of professional experience in the global non-profit and NGO sectors, she has built a career dedicated to policy, advocacy, fundraising, and governance. Her extensive background includes impactful work with major global networks, including her past role with the World Council of Optometry, as well as serving as a trustee for Sense International, supporting individuals with deaf blindness. Please join me in welcoming the Executive Director of VOS International, Maria Arce Moreira. Ms. Moreira, over to you.
Thank you very much. As the grandmother of the group, I would like to thank everybody for participating in this event. We, as VOSH, like to think that we support students to organize their activities and articulate their voices. So I think this first session was really interesting in the sense that you receive words of wisdom from very experienced colleagues. And the topic obviously was very challenging and broad. A couple of things I would like to rescue from that is never stop learning. Learning is useful at all levels and at all stages in your life. We have to think about the profession in a different manner. It's a lot about collaboration, interprofessional work, and we need to really see the profession in its all entirety and comprehensiveness. So it is important to ensure that we build that confidence, that knowledge, but also that critical thinking. Any profession you have, I'm an engineer, a civil engineer by profession. I'm not an optometrist. But when I was at university, we will be just sitting there and listening to what the faculty will say. We never ask real questions, and we never exposed our critical thinking. Even in engineering, you can do that. So I will encourage you, to ask, to share your thinking. As Laraiba said, there is no uh, good or bad questions. All questions are relevant. We need to develop our critical thinking. We need to exchange ideas. We need to challenge ourselves because the world is very different now from my times, ages ago. The world has changed a lot and will continue changing. And in the process, it will leave many people behind. You have a wonderful profession that enables people to access opportunities and live a life with dignity. So be open-minded about what your profession can do. The fact that you are part of this movement is already a great sign, give us great hope that the profession will, reach a great future. But yeah, when you have working groups, start talking. It is these are informal platforms. They help us to learn. They help us to exchange ideas. We are all willing to learn. You don't know how much I learned from you students. I learned a lot, but we need to be, we need to put your voices are important. You have to, show us the way because we all need to change. I think in this world nowadays where there is so much pain and inequality, either because of natural disasters, and I think a lot about our two Venezuelan VOSH chapters, or war, and I think about our colleagues in Palestine and our colleagues in Sudan and the ERC in many parts. So we need to, catch up. And it's okay to, look at the wonderful technology that is evolving, but we also need to equip ourselves with the clinical skills, the basic clinical skills that will allow us to deliver care for patients and be open-minded and be the voice for the profession. So I thank you very much for having joined us today. We are very proud of you as VOSH International. I can say that we are all very proud of the students. Sometimes our old bones are have difficulties catching up with you, but we are all, very supportive of this effort. So let's hope for another 3 more days of great work with you. And thank you again for participating in this first day.
Thank you, Ms. Moreira, for the closing words and for VOS International's continued partnership with this community. On behalf of OptoGlobe and the entire organizing committee, thank you all for joining us today. We look forward to seeing many of you at the upcoming sessions this week. And this concludes our day one of Global Optometry Student Summit. This is Nisha Bishowkarma. Have a wonderful rest of your day. Thank you.